Well, welcome everyone. My name is Dan Richard. Thank you all for coming to our virtual Faculty Lounge webinar. And this webinar is hosted by Center for Community-Based Learning in partnership with the Office of Faculty Enhancement, and a special thanks to Dr. Karen Patterson for setting up the virtual Faculty Lounge, and then also Suzanne Ehrlich for helping with all of the technical details and getting this set up. Today, Justin Sipes is joining as a co-host. Justin will be helping with our question and answer period. So if you have questions that you have along the way, it's okay to go ahead and ask those. At the bottom of your screen, if you hover down there, there'll be a little button that says Q&A. And so you can click on that and post a question there for our panelists or for the larger group to discuss. And if you'd like for Justin to read that question on your behalf, then you can post the question anonymously. Otherwise, if you would like to ask the question yourself and engage in discussion, then just post the question with your name, and we'll add you to the call so that we can discuss that as we go through the webinar. So this webinar is the second in a series of open forums and webinars that we're doing around how faculty are modifying things in relation to COVID-19 for community-based learning. And so our next webinar will be next Thursday. So all of our webinars are scheduled for that Thursday time slot at 2 o'clock. Next week, Justin will be hosting an experiential learning in extraordinary circumstances. So that will be interesting to talk more broadly about experiential learning. And we do have an open forum regarding community-based learning next Tuesday at 12 o'clock noon. So we have a couple of open forums scheduled just for open discussion, but we also have webinars planned as well. So I just want to make those available to you. All of those can be accessed through the virtual Faculty Lounge Canvas site. So in addition to the webinars and open forums, the center staff have also made available to you all some individual consultation times. And so Justin will post that link in the chat feature. So you can just click on that link and you'll see some different times where you can schedule to meet with a CCBL staff member and discuss anything you'd like in terms of planning for community-based learning. So we want to support you in that way. So we'd like to move on to our panelists. We have two faculty panelists for today's session, and each of these panelists will be addressing how COVID-19 has impacted their work and the work of their community partners. And then following these initial comments from the panelists, then we'll go into our discussion and answer period. And so first we have Dr. Karthik Umapathy. He's an associate professor in the School of Computing and the 1820 recipient of the FIS Distinguished Professor in Computing Award. He's the co-director of the Florida Data Science for Social Good program. We also have Connie Rausch, who's an associate professor and community-based clinical faculty in nursing, and the co-director of the community-based nursing program at UNF as well. So I've asked the panelists to address how they have modified their courses and their programs to address COVID-19 challenges and what they've learned through that process. And so that's what we'd like for them to address. And so why don't we start with Karthik? Let us know. Are you muted?
Yeah, unmuted myself. All right, good. Yeah. So few things. So there's two different aspects where I do community engagement. One is the senior project, which is a computing capstone course. It is a 2-semester course. Students in that develop web application systems for nonprofit. Then the second aspect where I do community engagement is with the Florida Data Science for Social Good program, which is a summer internship program where students develop data science solutions for nonprofit organizations. So the Data Science for Social Good program is ongoing this summer, and the students will be presenting their final results in August 18th. It's all conducted virtually. So we, Dr. Richard, to be full closure, Dr. Richard is another co-director for this Data Science for Social Good program. So we did all the project scoping, students interviewing, working with the students, all remote. The kind of the work we do was conducive for it, but we had to be careful on which projects we pick. So we picked projects in a way where students would not need to realistically see the client, see how they do their work, to empathize and understand the problem in that way. So if we put problems that we would be able to understand based on the data they will share and based on the description they will provide us. So sometimes we pick a project where, yeah, their description is not going to be good enough. In order to solve the problem, the students would have to observe the problem they are facing in order to develop the right solution. So we were a bit sensitive about that. Now that I am doing project scoping for my senior project course, that is be happening in the fall 2020 and the spring 2021. So I'm ongoing project scoping for it. So I am being very careful on what projects I'm picking so that it is not, when all the interaction happening virtual, students are able to obtain the necessary information from the client so that it is not affecting their performance and it's not affecting their capability to make impact for the nonprofit. So I would say that first thing starts with if you are doing project-based you work based on projects with your community partner, then the scoping comes into the major play. You do need to now start paying attention to that so that you are scoping and selecting the projects that is going to be conducive for virtual environment so that your students are able to obtain the information they need in order to perform well in the class and perform well in the project, and they are able to make the impact for the client. Apart from that, there's a lot of communication tools I use within the class. So I can go into that, but probably I will let Connie talk a little bit before I go into those kind of things. I involve not only nonprofit, I involve industry members coming into class and interacting with the students. So that's another challenge now. I have to figure out how I do. Senior project class is already a flipped classroom. Many of the key topics are already in a video format, so that helps a lot. But I created videos in the class to have more direct interactions with the teams on the project they do. So I do a lot of active learning activities, which works well when I'm walking around and looking at and talking to each teams and seeing how are they struggling and help them make the connections to the project. Now I can't do that. There's no way I can walk around with them inside a Zoom call. Now I really, really need to figure out how do I do it. So those are the other challenges that I need to really figure out how I'm going to handle it. But right now I'm more concerned about picking the right projects and finding out the right industry partners to mentor students. And some of my previous mentor already said they will not be willing to take part for the upcoming year because COVID-19 is affecting them. And even though they're working from home, they are stressed. So I am working through those issues now over the summer. So that's kind of, I want to give right now the background. So let Connie share her background, and depending on the questions others have, I will be able to share more into how I'm redesigning as some aspects of my course. And Connie.
Thank you, Kartik. I just have like a really, really short little PowerPoint because I want to show you something. And I think it's better to show you rather than me just talk about it. So let me put this up. Everybody see that okay? Yes? Okay. Oh, I see you shaking your head, Dan. All right, thank you. Basically, we have remote service learning. We started this summer in what we call our community home bases. And a home base is like a geographic area set of agencies, and they're all anchored by faculty partners. So we'll have like 4 or 5 of them in the whole area, and each one has 2 faculty that work with them. And I wanted to bring this up first because talking about remote working, I need to talk about what home base is first, so you can see how this dovetails into the student experiences. And basically the students are enrolled in a home base their very first semester out of the 4 or 5 semesters of the program. And then they're in that same home base for like 15 to 20 service learning hours every semester. And so they get to know people, they get to know the partners, they become very familiar with the place itself. And that builds on how we've been able then to do our remote projects and have the kind of relationship with the partners that we need to do that. And the final semester students, I'm just going to show you their projects first because I had about 20 of them this semester. Anyway, they have to put in 90 hours for their project. So moving to remote capstone projects, then we had to develop them through remote partnerships, working with our partners remotely, and then thinking of activities that are based on previously determined community identified needs. And most of the students, by the time they get to the end of the program, because of that continuity in place, really understand the community identified needs as we go into it. We did allow them to use simulations for half of the 90 hours because it was very difficult to get a project where they usually we go to the place, you spend 8 hours there, you know, weekly, and we couldn't do that kind of thing. So we had different kinds of modules for them to complete, some of them from public health sites, some of them related to COVID-19 and from sites with the World Health Organization and the CDC. So they could do up to 45 hours of those kinds of experiences. But we also had to shuffle our priorities for being remote because our students also have clinical hours in hospitals, and we couldn't even get into the hospitals until about halfway through the semester. And these guys need so many hours to graduate. So the whole idea was that we would not go into the community, we would continue remote because we didn't want them to be exposed in the community and not be able to go to their other clinicals that are so precious. I mean, they're all precious hours, but it was a real issue that came up for us. So basically, the students developed brochures and handouts to distribute, and the partners distributed a lot of stuff, but the whole idea is that they will then go back and use surveys and educational materials when they can get back to future face-to-face contact. They also reached out to community members with phone calls, Facebook sites, and other social media platforms. Just really quickly, I'll have you look at some of the projects. I'm not going to read all of them, but you can get an idea, and I'll make this available if you're interested later. We had one group that developed a survey and mock scenarios for future teaching then for healthy communication for residents of the ARC Village. And then we had another group create additional education resources, which is part of a whole set of educational resources that we've already set up for the Community Health Outreach Clinic. Here are all the different ways that we developed educational materials, but a lot of these were to be used by the particular agency themselves, so not necessarily for us to go in and use them. So we did a handout on safe sleep to be given in baby packs, handouts about hands-only CPR and chlamydia prevention, which were to be distributed on the UNF campus. And we'll do that when we can get back out, and possibly in the fall we'll be able to do that. You can see some other things here. We did have a COVID-19 brochure that was tailored to the needs specifically of people at the City Rescue Mission. We did other things about COVID-19 as well. We extended past projects. So there's a playbook we've been developing for child life volunteers in this long-term unit at Nemours. And so we added sections on infants and toddlers to the playbook. And we've been working on this playbook with our projects over the past year. So we're building on it as we go. And here's some other ones that I kind of talked about already. Telehealth is the thing that was really interesting. And when we talk about telehealth, what we're talking about with the HRSA definition says it's the use of electronic information and telecommunications technologies to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. And it can include video conferencing, internet, store and imaging, streaming media, and terrestrial and wireless communications. So some of the things that we did in terms of outreach, we reached out to socially isolated seniors, particularly in one senior housing complex where we'd been working face-to-face. They knew us well, and we sent out a request or a flyer that said, you know, do you want to participate in weekly phone calls for us to just listen to how you're doing, support you, and then give you any information you need about your health or your health care. And we had about 20 residents respond, and we had, you know, consent forms. And so we had wonderful response, and they obviously with seniors, they stayed on the phone for quite a while for each of their calls. People, you know, were by themselves and they needed that interaction. Then a lot of the seniors, to our surprise, asked for us to build a Facebook page for them. Now we thought, you know, digital divide, a lot of these people, it's low-income seniors, they probably don't have computers or telephones, you know, internet telephones, that kind of thing. And we were surprised because we shouldn't have made that assumption, because a lot of them do, and they are on Facebook. So the students developed a page and wrote out a tutorial for accessing that page in particular, and started posting health-related information. And this page is just getting up and running right now. So a group in the fall will take that over and continue that. We also had weekly live presentations for the Jewish Community Alliance on their Facebook page, and we're posting playlists for health promotion activities. Otherwise, for telehealth, we've developed and posted TikToks. We've continued our recruitment of volunteers in medicine clients who are getting telephone nutritional consultations. And we wanted to look at why they did or did not participate in this particular nutritional counseling. We had online outreach to people about flu vaccinations and more TikToks related to safe practices related to COVID-19. We also had to orient first semester students to service learning in general and to their particular home bases. So we had the final semester students orient them, because of course they already knew the place and they were able to tell them stories about the home base. We couldn't get them out there. We did have some partners talk to them, and the students used discussion boards and put up particular topics and interesting things that the first semester students could respond to. And they developed, again, a Facebook page for that and used that to communicate with the first semester students. And I just got off Zooms with both groups, and they felt that that was really helpful and would like to continue it. So challenges that I find, finding those simulation activities was a challenge, going out and looking for online modules related to public health and public health nursing, motivating students to stay on track throughout the semester. They tended to get, what am I trying to say? They were pulled away to other activities. They're extremely busy with all their classes in that final semester. And I had weekly meetings with them to say, okay, what are you doing? Where are you? Where have you gone with this? To keep them going, because they could get pulled away again. Again, helping the partners and students understand what they can and cannot do in this particular climate, and in terms of the experiences that we'll allow from a remote situation. And then maintaining our relationships with our partners, because they were busier than usual or closed for business, some of them. And they had ongoing changes in their own rules and regulations that we had to negotiate. But surprising things, our weekly meetings were easier on Zoom. You know, the students didn't have to come from wherever they lived to campus for us to meet, or to other places where we met, where the partners are. So we could get together, we could get times to get together, and had people there more often than we usually do. I was really pleased with the creativity of students and partners as they developed and implemented those projects that I was talking about, because they do work in partnership directly with our community partners. We kind of, for that final semester, faculty are more facilitators, and I was wondering if I would have to do more this semester than I usually do, but that was not the case. Less driving time, so more time to work with the students. I'd rather not have that, but, and like I said before, the digital divide was less than I expected. So that's what I had to share, very briefly.
Thank you, Connie and Karthik. So what I'm hearing is that some similarities between both of your stories was the idea of really thinking about what you can do, what you can't do. You know, Karthik mentioned scoping out the project to see if it was feasible, what's possible, you know, what can be achieved. And then something that was consistent as we spoke with some of our community partners was this idea that this virtual environment sparks innovation. We find things that work in this type of environment that we wouldn't have thought of to use in a regular environment, and that we're often surprised at how well things can work in a virtual environment, and you know, maybe it's not as much difficulty as we had anticipated. So if you, so for those who are attending and interested, if you'd like, you can post some questions at the bottom. I'd like to do a quick poll and just get a sense of how our participants, how you're responding to the challenges of COVID-19. What are some of the things that you're thinking about? And so Justin's going to start a poll about that. So please select what you think is the best answer, what represents your response. So how would you describe the impact of COVID-19 on your plans? All right, it looks like we've got most of the votes in. So we'll go ahead and end the poll and share those results with everyone. Yeah, so mostly major changes going on, but yeah, I also see there's some uncertainty still about how all these things are going to play out. And, you know, that's true in what we've been hearing from some of our faculty members and community partners as well, that there's still a lot of uncertainty, and, you know, especially when things are changing, things are shifting. It's, you know, the university has kind of established some guidelines for doing experiential learning and how students are supposed to interface with the on-campus environment as well as the off-campus environment. And yet, you know, we're still a month and a half away, and there can still be changes in that short amount of time. So I think we're all trying to respond to those. All right.
So Dan, if our attendees don't have a question, I can share the issues with communications and some suggestions on using communication tools.
Yes, go ahead.
Right. So with my senior project, it's a 2-semester long course. So motivation, as Connie said, is the key issue that's going to be a challenge, and I am worried about same issues here. So communicating with the students is one thing. Students communicating with the partners is one thing. Students communicating within their team is one thing. and me reviewing their project progress and meeting one-on-one with the students and providing input is another thing. So I see each of them as separate communication types and recommend communication technologies accordingly to students. So for example, I don't know how many of you heard Slack. So for all the within the team communication, I recommend students to use Slack communication tool, which is better than them communicating via phone, text, or email, or God forbid, they communicate using cameras, right? So Slack is a really good way for them to do team one-to-one communication as a group, communicating with each other. All their meetings with client I would be recommending for them to happen through Zoom, and it needs to be all scheduled. All the meetings that's going to happen for the fall semester should be scheduled ahead at the first week of the fall semester, and it should be booked to all the clients' calendar so that the scheduling doesn't become an issue. So mentors, industry people who give advices to the students, they also will be communicating to the students through Slack, right? Then my interaction with the students, all the class scheduled meetings will happen through Zoom, through Canvas. But whereas whenever I have to have one-on-one meeting with each student team, which happens very regularly for me to keep tabs of each student, what's the progress they're making, what the challenges they're facing, recommending solutions for it, all of that I plan to do through Microsoft Teams. Because Teams is sharing is good, and video audio communication is much better than others. Their video feature is stronger than the others. So that's what my plan essentially is going to be. And the active learning aspects is the key challenge that I haven't yet figured out right way to do, where I'm able to put the questions up and walk around and see how the students are struggling, where they're struggling, and provide the advices for it. That is still, I haven't figured out what's the best way to do in a remote setting, in a manner that I used to do in a face-to-face thing. How much I can retain in a virtual environment is not something fully figured out yet. So I just wanted to share that there are wide varieties of communication tools exist. Many people think that, oh, I'm going to pick one and stick to it for all form of communication activity. I'm kind of suggesting that approach may not be good. So you really want to think about who those two stakeholders, who are they interacting, and decide the communication technologies accordingly. All tech exists for a reason. That's why we have many as opposed to just one. So when you guys thinking about how the students are going to interact with those different stakeholders, suggest those technologies accordingly. You don't want two technologies used at the same two different stakeholders. One technology for interaction of two different stakeholders, but a stakeholder may end up using multiple technologies to interact with multiple stakeholders. I hope it makes sense.
Yeah, thanks. And Connie, it seems like you also the students were using different tools and social media outlets, that sort of thing. So how did you communicate with your students, and how did you communicate with, or how did the students communicate with their community partners? Like, what tools were you all using for that?
Well, I think Zoom was used a lot, and our students introduced partners to Zoom. And I mean, we also speak to residents in the communities, not just people from agencies. And so we did have to use some telephone calls. People don't have the internet access. And so we used Zoom and telephone calls. Also, though, they did use Facebook a lot, and partners were on Facebook with us. So we try to incorporate them into everything if at all possible. But I'm personally not a major fan of Facebook, but it worked out really well for them. And so I think that's something that will continue. Yeah, phone and Zoom and Facebook were the three major ways that we communicated with people. But really, it came down to the partner. We could use all of these different things, but it came down to the partner and what they were comfortable with. And so that's how that worked out.
Yeah, I saw that the students had used TikTok. And
oh yeah, forgot about that.
But yeah, I wondered if there might be even some Facebook Live sessions, right, that you could do in an educational to push out educational information.
We actually did that Facebook Live session. Yeah.
Okay. Yeah, and if any of our attendees, if there are tools that you've used that you'd like to recommend, we'd love to hear from you about what tools are working well and in what context for that. So let's imagine I'm a faculty member and I haven't started revising. I'm in that kind of, I'm not sure what I should be doing at this point. What are some recommendations that you would have for someone who's in that type of situation, that position? What would be sort of the first steps you think you would take? I'll let Connie go first, maybe. Or
Yeah,
okay,
Connie,
Karthik, yeah.
first?
Yeah, go ahead. Karthik, go ahead.
Connie, you want to go out first? Go ahead, Connie. You go first. I'll go later.
Okay. Basically, I mean, what we did, because we started, remote halfway through the semester in spring, we immediately got students and partners together with us to start talking about what was possible. And again, my role was to say what students could and could not do, because that's one of the ways that I always represent the students. They don't always have that knowledge, obviously, but really a meeting with everybody is the way that we started. But students were able to bring to the meeting different things that the partners didn't always see, because they always have these fresh eyes on what's going on in their partnerships. So a lot of the projects the whole idea came from students, but that was because, again, they had been in that situation for 2 years before they ever got to the point to do the project. So, but we always work on community identified needs. So that is the best way, is to have that conversation first.
So just want to remind everyone first, students always will complain no matter what you do. But when students see that you are working hard on something, they adjust quite a lot to accommodate their schedule to the project. So I want something remind you about that. So that kind of goes to what Connie said. They don't know which is the no entry area, which are the entry area. So this goes back to the project scoping becomes, that's the one thing that you really need to know. Now in my virtual environment, what is the right fit project? Which kind of the projects you really feel cannot be done without them maintaining the social distance measure, right? So that's the key thing you have to think about. So from that point, it's then the touch point areas, the interactions they're going to have, which interaction, what type of interaction are conducive for the virtual environment, how they will obtain the information from their projects and their clients they are working with, how often now they would have to talk if they're doing in a virtual environment. You would have to think about it. Say, for example, before you might have, morning 9 to 12 noon, I want you to be there in this part, observe, gain information, and then come back, write reflections. Yeah, you can't think of them doing 3-hour Zoom call, right? That's just may not seem the right way of to do. So now you may be dividing that as 1 hour call across a week. So that those kind of strategies now you have to rethink. And what is the projects or what type of activity now is good fit for that. You may have to think about it. So I would start with project scoping, type of the interactions, and how many instance of those interactions is going to happen in a week, and go from there to figure out what stays, what doesn't stay as part of to achieve your course objectives.
I would also say that one thing that I'll be doing for fall, which, you know, now that we've got things established and we have the same partners all the way through. So the partners know what are the best ways to communicate. We've already got that point set up. So it makes things a little easier for fall, and they know the kinds of projects that we can do. So if we're going to be remote the whole time, which I hope not, but it's a possibility, then we have that set up and we have things we can build on. And that's one of the things we do, is that we have a project, but then we can add to that and add to that as we go through the semesters. So that whole relationship, remote relationship, I guess, has been set up already. So we're really fortunate for that.
And I wondered if you would also speak to, and this is something that I heard as each of you were presenting, was the idea that in some cases, the community identified needs have not changed, right? So there's still a need for certain services or things that are happening within the organization are still happening, and they still have needs that really haven't changed. And then in other circumstances, we see a shifting of emphasis in the organization. So their needs are changing, and it may not necessarily line up with the projects that the students were trying to do, or how maybe there was a need already there in the community that becomes heightened under the influence of COVID-19. And I'm thinking of some of the health related issues, right? That now it's even more important that we talk about respiratory issues and diabetes and things like that. So I was wondering if you all could talk about like that interaction that you had with community partners. What are the things that you're seeing that are shifting and changing? And what are some of the things that are sort of remaining the same in terms of what their needs are and how students can help them?
Yeah, so most often for my senior project class, the type of the projects we pick, we are helping those organizations track information in a consistent, reliable manner. So that means they would need some kind of web forms where they're able to do data entry and data that those data are going into a web-based database, and then those partners are able to query and pull those information in. So that's the good gist of what type of systems and solutions we do for nonprofit. So that's the similar is what I'm scoping the project for. But most often the partners want to track many things. So when I'm picking the project, I'm keeping in mind that I'm not picking the projects where the current environment makes their idea useless. So for example, there was one organization, they really wanted to track, they provide housing for AmeriCorps kind of individuals. So they really wanted to track, they wanted to build a reservation system type of the thing, and they wanted to track who's staying, how long they're staying, yada. But then this whole COVID-19 means those individuals really can't come and stay and use those resources anyway. So I have to shy away, make them shy away. Like that's not, it's mission critical for you, but I'm not sure that's the right project to work on given the current COVID-19. So let's track something else that is more mission critical given the condition. So shy away from projects like that. Then because in middle they will say like I want totally different, and that will be that won't be feasible at all for the class. So I think that's yeah. Again, it goes back to the scoping again. Is the key thing because for me, it's always that, because that really sets what the students will be do, and it sets fits to what I'll be teaching in the class. So that's kind of becomes a very, very fundamental decision making. So I don't know whether Dan that addresses the full question you asked, but yeah.
And Connie, what do you think?
Obviously, I've been on Zoom how many times and I couldn't unmute my audio. Really? Anyway, basically, you know, I will have to say that most of our projects were continuations and they were negotiated. So we didn't have that much in terms of having to cut off relationships with partners. Although one of the major things that we had to do was with the health department. And students usually go to clinics in the health department, and that was not going to happen. But you know, usually we would do some other kind of project with them, but they were running the whole command center for COVID-19 response in Duval County. So that was not going to happen. I mean, I wouldn't even ask them to be a part of this. So I had to move students to something else. And we found other projects that were out there. And some of the other faculty who are not involved in community home-based activities came to us and said, you know, here's something you can do that's needed. And we set up relationships at that time, like the whole notion of milk banking and having new mothers donate milk to the milk bank so that there would be milk for particularly premature babies and the babies who are very premature, and much better for them than formula. So that's a difficult thing to talk about. And WIC came to us and said, we need something to teach people about this. And there's just not many materials about it. So the students did a wonderful job with WIC, and they worked with them directly.
Yeah, this the consistent story that I'm hearing is this. Yes, they're reducing opportunities, right? The opportunities are diminishing, but then there are some other things that are opening up, right? And it's really about innovation and finding those opportunities and maybe adjusting to, you know, things that students maybe are and faculty haven't necessarily thought before about what they should do. And now it's like, well, maybe we should try something different, right? Maybe we should try something new, and discovering that those things that we're trying new maybe aren't, maybe they're pretty good, right? Yeah. Well, if there are no other questions or any closing thoughts that you all, the panelists, would like to share, or any kind of closing questions for our attendees, let's go ahead and get those.
Yeah, I just want to add to what Connie said. For me, it's very much similar. Those some of the bigger nonprofits who tend to have repeat projects with me every year, actually many of them are shying away this year. It is that the COVID-19 social distancing measure is adding stress to the staff, so they're really trying not to add more to it. So it's happened so well. Kind of, I'm working with Red Cross this year, so they are pretty big. But most of the other projects I have, they are really, really small nonprofits, like one-man, two-man army type of, just less than 10 people working on a type of nonprofits. So yeah, Connie, you're kind of right. It's stressing out a whole lot. And same thing, the software development companies with whom I'm working, I'm kind of having a tougher time with them too. Usually they all jump in to help out students, mentor it, and this time people are shying back away. So yeah, we helping others is harder, and we getting help from others is going to be an harder challenge as we do remotely, and students all understanding that is going to be a challenge for them, why things don't come easily now. This other thing. And in regards to students working on the project remotely, task management tools is another one now you have to think to help students manage the task, and you know what task the students are working on is another thing. So Trello is a really good one to use it. So that's another recommendation that I would recommend faculty to use if your class projects are all project-based thing, like what Connie deals with or what I deal with. Then task management is kind of good. So it will allow you a cleaner visibility for you to know what the students are working on, who's working on, how are they managing and dividing it and doing it, who's doing it on time. And it's a visibility for them to see what task within the team who's working on it. So Trello is a free one. There are other better ones, but I don't use Trello, so I use something else in my class. So, but that's separate. So, but for others, I recommend Trello.
And thanks, Kartik, for that idea about Slack. I had heard of it from my daughter who works as a coder, but anyway, I just hadn't thought about using that with the students, and that sounds like a really good idea.
Yes.
I appreciate that.
Highly recommend that.
Great. For our attendees, I just wanted to let you know that I did post in the Canvas site under the CCBL section of the virtual faculty lounge. There's another page on there of resources. And what I've included in there are links to some virtual volunteering sites, websites, where students can go in, register with an organization, sign up to do a virtual project with that organization. And so there's one that the United Way of Northeast Florida has put forward. So there's virtual volunteering opportunities for something locally through United Way. There's also internationally a United Nations volunteer portal. And so you can work with community agencies across the world that are doing work in other countries that have needs, and they have projects that students can sign up for. And there's also an online portal for virtual internships called CoVintern. So that's kind of a new thing that's kind of cropping up. And then there's a new program for those who do data science work called Solve for Good. And so a lot of the research projects and statistics projects and data analysis projects, there might be some opportunities there for faculty to look at their students doing virtual projects for different organizations. So just wanted to make those resources available to you. And thank you all for our panelists. Thank you, Karthik. Thank you, Connie, for sharing your insights.
Thank you.
Also thank our participants for attending, and Justin, he's been keeping up with the conversation and posting things in the chat and including links. So thank you all for that. This session will be posted on the Canvas site as a recording, but also I just wanted to remind everyone that we have another session next Thursday at 2, and Justin's going to be moderating that panel on experiential learning. And then we also have an open forum on at noon on Tuesday. So hope you have a chance to participate in those, and let your friends know and get the conversation going. The fall is going to be here before we know it. So the sooner we can start making these plans, the better. So I want to thank you all and appreciate all of your efforts. Thanks so much.
Thank you.
Thank you for including me.
Mm-hmm.
Yes.